Assalamualaikum and hi everyone. So this is topic 5 of unit 5 waste management. Learning outcomes for this topic is 1. Describe the waste management regulations. 2. Explain the correct classification, segregation, handling and transportation of waste. 3. Explain the occasion and method of reporting for any adverse events, incidents, or accidents concerning healthcare waste. For the definition, what is waste? So waste consisting wholly or partly of human or animal tissue, blood, or other body fluids, excretions, drugs, or other pharmaceutical products, swabs or dressings, or syringe, needles, and or other sharp instruments, being waste which unless rendered safe by may prove hazardous to any person coming into contact with it. So we're talking about the clinical waste, not just any waste now. Any waste arising from medical, nursing, dental, veterinary, pharmaceutical, or similar practices, investigation, treatment, care, teaching, or research, or the collection of blood for transfusion being waste, which may cause infection to any person coming into contact with it. So these are the definition for the clinical waste. So pay attention to the red bold fonts because those are the essentials of clinical waste. As you can probably see clearly now, this is the symbol of clinical waste. So you might see this in all clinics that has clinical waste rubbish inside the bin. They have this kind of symbol, and sometimes you do see the transportation part as well, the lorry or the trucks on the highway. They do have this symbol, then you know they are carrying clinical waste. Okay, just to uh, get you used to this color coding system. So these color coding are used for different kind of waste. All right. So the most common that we are used to is black, which dictates the domestic waste, which does not contain any sharps or medical waste or any infectious material. So we call it domestic waste. So we use black. All right, then there's a purple one, which not very common in the dental clinic, which is a cytotoxic or cytostatic, which must be incinerated in a licensed or permitted facility. So we don't see this purple in dental clinic as well. So does green. So green is non-hazardous medicinal waste which require incineration in suitably permitted facilities. So we don't really have green because green usually used in the pharmaceutical arena. And then there is a yellow and black, which is an offensive or hygiene waste which may be landfill in permitted or licensed sites. All right, so we don't have yellow and black waste in our clinic. And then orange, which is an infectious waste which may be treated to render it safe to disposal, or alternatively it can be incinerated. We do not have orange as well, but we do have yellow, which is the last one here, which is the infectious waste or any uh, clinical waste in the clinic are considered as infectious waste. Okay, so you will see our yellow bin with the yellow waste plastic bag in all clinics and also in every cubicles, in student cubicles and clinics. Okay, so that's what is available in our clinic. All right, according to WHO classification, again, there are about six waste categories. The first one is general, which is the black one, just we just discussed just now. And there is also pathological waste, human tissue or fluid, sharp waste, infectious waste, chemical waste, and radioactive waste. So in our facility, we are having either general waste, pathological waste, sharps, and also infectious waste. So these four are very common for us, but for number two and number four, we use the same yellow bin. And then the sharps, we have a special dedicated for sharps bin. Okay, so I'll show you later. All right, so again, this is another diagram to show you where it goes into the bin. Okay, so you can see again the black one is actually the non-infected waste, which sometimes we call it as the domestic. Is different than the other four, which is the infected waste. Okay, so when we go to the biomedical waste here, talking about solid biomedical waste, they actually have another segregation of it. So normally we are using the yellow for the dental clinic, which is here is called as anatomical waste, but we also have syringes, gloves, and plastic waste. We don't use this coloring coloring coding for our clinic. We only use yellow. Okay, this is based on the Malaysian guidelines too. So as here is just to show you the segregation of solid biomedical waste used by hospital or in other countries. Okay, so you can see what goes into it and how they are disposed. Okay, how they are disposed at the bottom here. So you can probably read that later. Okay, this is what we have in our clinic, in the dental clinic. So we have the sharp bin, so any sharps, okay, should be disposed in this bin. So what are the sharps? Needles, IV cannula needle, endophiles, scalpel blade, and probe. So anything or everything here can be thrown inside this bin. All right, this is the regular clinical waste bin, which is yellow too. Clinical waste bin. So any clinical waste which are not sharp can be thrown into this bin, which is gauze, cotton rolls, gloves, mask, bib, rubber dam, and also extracted tooth. Okay, then this is a different one. This is actually for the blades only, but this is also a remover. Okay, so it's called blade remover and waste receptacle. So you have to insert the blade in here, and this gadget will actually disengage the blade with the holder. So it will reduce chance of sharp injury. Okay, so we do have this in our clinic. So you use this to dispose your blades. As per documentation by the Malaysian law, we are bound to the Environmental Quality Schedule Waste Regulation 2005. So with this act, we need to properly manage our waste in the clinic. If you are opening your own private clinic later, you need to find a company that um, manage this clinical waste, so we pay for their service and they will come and collect our clinical waste every day. Okay, so as for the bigger facility like hospitals or dental faculties, they would have their own centralized system by any companies that comes and collect all the waste. Okay, all right. Thank you for this short lecture. Bye.